The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
A loving Creator has made us very well, but women are made very complex, and because of that, sometimes we have problems with the body. Now, we'll be discussing some of these problems that women may have.
Welcome to Help Yourself to Health with Dr. Agatha Thrash of Uchee Pines Institute. And now, here's your host, Dr. Thrash.
The female breast is very subject to cancer. Some people have called it a precancerous organ, and in Americans it certainly is. One of the highest rates of cancer that we have as women is in the breast, and it is quite a serious cancer. Women should learn to examine the breast. And the way to examine the breast is very simple. It simply means taking the fingers and examining every part of the breast itself. And in order to do that, we find that it's proper for a woman to get in the shower and while she has soapy hands, to entirely examine all parts of the breast. The breast is made up of 4 quadrants, let us say. So she would examine first one quadrant, then the other quadrant with soapy hands. And this way the friction between the skin of the hands and the skin of the breasts is reduced. Another good way to examine the breasts is while lying down in a firm bed or on the floor. If the breasts are large, then the one arm can be placed over the head in this way. That allows the breast to flatten out over the chest. Then again, it's done one quadrant after the other. In this position, or with the arm at somewhat of an angle like this, not over the head because that pulls the skin too tight over the armpit, but at an angle somewhat like this, then she can easily reach with her fingers into the highest part of the armpit, and with a sweeping down movement, she can make a nice examination of the armpit. As you know, there are some lymph nodes in the armpit that drain the breast, and these lymph nodes can carry cancer. So sometimes a cancer is small enough in the breast that she isn't aware of it in the breast, but in the armpit she can become aware of it. Now there is another nice little trick. It's called the towel trick. A surgeon discovered this when he made a cursory examination of a patient with her slip still on, and he found a nodule. But then when the patient was fully undressed, he examined the patient again and couldn't find the nodule. Suddenly he began to think, well, perhaps it has to do with the fact that my hands have a little friction on the skin now and didn't have when she had her slip on. And so he asked the nurse to give him a towel. So he put a thin towel over the breast and did the examination again. And he found the nodule. That's called the towel trick. You might try that with a thin cloth, a thin fabric of some kind. Just put that over the breast and try your examination in that way. Now I'd like to talk with you about some of the risks that we have for breast cancer and some of the things that can cause women to have an increased risk. So let me just read some of the known risk factors in getting breast cancer. One is that of race. White women have far more cancer of the breast than do Oriental women. Previous breast disease, especially a breast cancer. If a woman has a breast cancer herself or a first-degree relative, that increases the likelihood that she'll get another cancer of the breast. Now, a first-degree relative is mother, father, brother, sister, son, or daughter. And men do have breast cancer. And cancer in them also increases the risk that all first-degree relatives, even of a man, will have a cancer. Then the next is the number of pregnancies that a woman has and the age of the first birth. If the first birth is before the age of 25, that reduces her risk for getting breast cancer. Unfortunately, it increases her risk for getting cancer of the cervix. We think the reason for this has to do with a reduction in the total number of cycles that a woman has. Every time a woman makes a hormonal cycle in the menstrual cycle, that has an influence on the breasts, and we think that that increases the risk of getting cancer. So the fewer total number of menstrual cycles that a woman has, the lower the risk of cancer of the breast. Then Rauwolfia or reserpine medications for blood pressure. These are also likely to increase a woman's risk. Living in a cold climate, probably because of chilled extremities, that too makes a woman have a problem with an increased risk. Chilling of the extremities reduces the immune system in a number of ways. It makes us more susceptible to viruses, of colds and flu, and we must remember that cancer is also caused by a virus. Then an iodine deficiency. Also, the taking of thyroid medication if a woman does not need thyroid medication. Some women are taking thyroid medication because they get cold in the winter, or because they're overweight, or for some other reason. We don't recommend this. We recommend that people take thyroid medication only if they actually need it. A selenium deficiency. Now this comes about from not eating sufficient vegetables and whole grains. A B vitamin deficiency and being overweight, especially weighing more than 140 pounds. If a woman is taller than 5 feet 6 or weighs more than 140 pounds, either one of those makes her more susceptible to having cancer of the breast. If her overweight occurred before the age of puberty, that also increases her risk. Religion is another factor. Jewish women have very little cancer of the breast, whereas other women have more. Women who are high in the socioeconomic level, they tend to have more cancer of the breast. If a woman has wet earwax, that increases her risk. Now you may wonder why that is. If a woman removes earwax and it's wet and sticky as compared to dry and crumbly, that means that the form of estrogens that she has in predominance is the kind also that increases a woman's risk of getting cancer of the breast. If a woman produces nipple secretions, that increases her risk. The heavy use of animal products, especially those that are high in fat, and the excessive use of free fats. Breastfeeding one's infants. The longer a woman breastfeeds and the more of her children that she breastfeeds and the more children she has to breastfeed, this reduces her risk, apparently because it reduces the cycling of a woman's periods, since women who are breastfeeding are very unlikely to have periods during that time. And then breast trauma. If a woman has injuries to her breasts, especially multiple injuries, that will often cause a woman to increase her risk. Now the next woman's disease that I'd like to mention is that of ovarian cancer. Ovarian cancer is getting to be more common. It is increasing in incidence. Ovarian cancer has recently been associated with an increased intake of all animal products and especially of dairy products. And that particular dairy product most likely to be involved than others is yogurt. A study published in London in 1991, I think it was in December, implicated yogurt as a causative factor in cancer of the ovaries as that dairy product most likely to be involved. But any high lactose product, dairy product, such as cream cheese, cottage cheese, or buttermilk would also be involved. Now, PMS, or premenstrual syndrome. My husband and I have written a book called Premenstrual Syndrome. We enjoyed studying this disorder, and it has a number of factors about it that I'd like to bring out for you. The first is those symptoms that are most likely to be experienced by women with premenstrual syndrome. All sorts of symptoms can be associated with the premenstrual syndrome. First, let me state that it is in the premenstrual period. It's from the time a week or two before the period up to the period. And usually the onset of the period causes a reduction in the symptoms. For an occasional woman, she will continue to have symptoms most of her period through, and it is still called the premenstrual syndrome. I like to reserve for the premenstrual syndrome that specific type of problem that occurs from the time of ovulation until the time that the period begins. I look for other causes of the woman's symptoms if she has them on a continuous basis. I'll read just a few of these multitudinous symptoms that a woman can have. Abdominal bloating and cramping, accident proneness, inability to concentrate, incoordination, insomnia, or sleepiness, either one. Irritability, itching, joint pain and swelling, sleepiness or lethargy, a loss of appetite, migraines or simple headaches, mood swings, muscle pains, nausea, noise sensitivity, a racing heart, rage, restlessness, seizures, sinus problems, sore throat, styes, and just on and on. Suicidal thoughts, thirst, ringing in the ears, and fatigue, and food binges. All of these and many others. I read perhaps a third of the list of symptoms that women have complained of in the premenstrual period that they don't have at other times. Now, as to the causes, we should look first at lifestyle, and a woman who has the premenstrual syndrome should first of all make certain that she is keeping all of the 8 natural laws of health. The blood sugar is also associated with the premenstrual syndrome, and of course we understand that one of the reasons that women have high blood sugar is because they eat foods that are from the refined carbohydrate group. That increases the likelihood of getting a high blood sugar. The use of excessive quantities of protein in the diet. And of course the use of dairy products. A group of women studied in this country showed that women having a high use of dairy products also tended to have more premenstrual syndrome. Vitamin B6 deficiency may be experienced by some women, and these women may experience something like insomnia or numbness of the face or hands. Caffeine is another one that we know is associated with PMS. 4 cups of tea increased a group of London women's PMS, and of course for London women, tea is comparable to our coffee. Then low levels of potassium, we can get those from fruits and vegetables, especially whole grains. Then magnesium. Magnesium deficiency is very common, and I'd like to read just a few of the foods that are high in magnesium. In our book, Nutrition for Vegetarians, on page 76, we have a list of some of these. Bananas, whole grains, dry beans, nuts, peanuts, and peanut butter, most dark green leafy vegetables. But the highest levels are found in grains, nuts, and seeds, and beans, and peas. Pumpkin seeds have been found to be very high in magnesium and in zinc as well. Exercise, a reduction in exercise is likely to give a woman the premenstrual syndrome. Now, the next problem that I'd like to mention for you is that of painful menstruation. It is also called dysmenorrhea. Dysmenorrhea affects quite a large percentage of women at some time or other, and fortunate indeed is the woman who never experiences any painful menstruation. And there are several very nice things that can be used to reduce the symptoms. One is the use of a heating pad. For generations, we have recognized that if a woman uses a heating pad on the abdomen, that this will sometimes reduce her pain. But what has not been recognized universally is that the very same heating pad put from the waist down to the bottom of the seat, that can also reduce the pain. In fact, for many women who have resistant to treat painful menstruation, if they will simply use the heating pad, often the best time before the pain begins, instead of waiting until it is well developed, use it for a full hour, then the woman can experience some very great relief with the heating pad. The next thing is that of herbal teas. A number of herbal teas can be useful in painful menstruation. Alfalfa tea, red raspberry leaf tea, red clover tea, black cohosh tea, catnip tea, angelica. There are a number. These can be taken as the teas, or they can be taken as capsules or tablets. One remedy that we have just discovered just a few months ago was that of the use of charcoal. A heaping tablespoonful of activated charcoal taken at the very onset of the period in women who have just severe painful menstruation, and repeated every half an hour. Heaping tablespoonful stirred in a glass of water. This we have found to be very helpful in some cases. The use of garlic, 1 to 2 cloves, 2 to 4 times a day, can relieve the symptoms of painful menstruation. Hot baths, just sitting in a tub of hot water. It can be waist high, or it can be only 4 to 6 inches high. The hot bath removes the blood from the congested pelvis and brings it out to the skin, and that often reduces pain, since congestion in the pelvis is one of the principal causes of painful menstruation. Then a nice little back massage, and I'd like to show you with this doll just how we can do this back massage. Let's say the woman is lying face down, and she can turn her head to the side, of course, and you find the waist of the woman. Then with the heel of the hand, you put the hand on the waist and rotate in this way, and use as much pressure as the woman can tolerate. Just rotate around and around in this way. Then move down just an inch and continue to inch down just in this way, inching down all the way to the end of the spine. Now, when I first read this in a medical journal, I thought, well, that's voodoo. Just on the right of the spine? Why would that be just to the right of the spine? But then I began to think that the outflow tracts to from the pelvis are on the right of the spine, and so that's the reason for its being on the right of the spine. Now, oh, by the way, it should be maintained for 4 minutes, going up and down for 4 to 5 minutes, and that will be very helpful. Many women find that completely relieves their painful menstruation. Then the next item is that of good posture. Be certain that you are standing erect, that the shoulders are back, that the abdomen has plenty of room to expand, and that you do deep breathing. In fact, deep breathing is one of the important things that we tell women to decongest the pelvis, because every time a woman or anyone takes a big breath like this, that brings blood from all of the lower part of the body as well as down from the head, so that we decongest the head and we decongest the abdomen and the pelvis and the lower extremities by deep breathing. So it's an important part of the way that we can assist the body. The next thing for painful menstruation is that of the elimination and challenge diet. Now, the elimination and challenge diet is done very simply. You get a list of foods that you know are likely to cause food sensitivities, and you simply remove those from the diet. And I'd like to mention the top 10 food groups most likely to be involved in food sensitivity. Of course, item number 1 is milk and dairy products. Then coffee, tea, colas, and chocolate. Citrus, fruits, and juices. The 4th group is wheat and corn. The 5th group is the nightshade group. Tomatoes, potatoes, eggplant, and peppers. Then the next group is strawberries, apples, and bananas. Then all the concentrated sweeteners such as cane syrup, sugar, molasses, and so forth. And then all other animal products, eggs, beef, fish, pork, and so forth. Then all the nuts and seeds, peanuts and legumes, all of these can be involved. And then the 10th group is garlic, onion, lettuce, spices, flavorings, fats, colorings, yeast. And I'm sure at this time you're saying, well, what is there left to eat? Well, there is plenty still left. It just appears that everything that we have in the way of food is on this list. But actually, you can recognize that those foods that we're likely to develop a sensitivity to would have to be those foods that we're being exposed to all the time. So those foods that are the most common are the ones we're most likely to get a food sensitivity to. Those are eliminated from the diet for a period of 2 or 3 months, and then if a woman has a reduction in her symptoms, then she can start adding back certain groups all at one time. And then if her pain comes back, she knows that something in the last group that she added back, that is a problem to her. Another way to find those foods to which a woman is sensitive is simply to keep a dietary diary. So you list everything that you eat and then see if for the week or so before the period comes, see if you have less pain or more pain when you're eating that group of foods. But usually for most women, the best way will be to eliminate the entire list at one time for several months and then add them back one at a time. Now the next thing is to avoid several things. One is avoid marital relations during the and just before the menstrual period. Avoid overeating. Avoid being overweight. Avoid tight belts. Avoid smoking. And for some women, they will find that they do better if they avoid salt. Now, proper dress is so important to women that I'd like to give just a moment to discussing this. It's sometimes fruitless for the physician to tell a woman to change her dress, and that will help with painful menstruation and with a number of other problems with the woman's anatomy. But there are some very good advantages to making certain that a dress has no tight bands, that they are quite loose, and don't forget that a belt that's quite loose when you're standing up will be very tight when you're sitting down. So the woman has to check her belts when she's sitting down. Do they dig into the abdomen when she's sitting? A second thing is, are the extremities warm? A very simple way to check that is to feel of the forehead. First are the hands, the same temperature as the forehead. Then check the back of the arm, that's an index area. Then the side of the thigh, the top of the knee, the side of the ankle, and the top of the foot. Those are all index areas to let you know whether you are chilled. If any part is not about the same temperature as the forehead, as well as the hand can discern it, then that part is chilled. You need more clothing on that part of the anatomy. Often women say to me, Dr. Thrash, I have poor circulation in my feet. they're always cold. Then I simply check her dress. I ask her how many layers of underclothing she is wearing, and often she will say, well, none. And then I turn up my hem and show her my own long johns or whatever the climate may require in order to keep the feet warm. That's what we have to wear. Just it is enough clothing to keep the feet or hands warm. And women who will pay attention to that will find that their feet are warm and their body functions a lot better. Their immune system is also much better. Now, there is another nice remedy for painful menstruation, and that is the hip stretch. And I would like for Don Miller to show you the hip stretch. For this, you get against a blank wall. He is going to get against a bookshelf, which you can do. It allows the head to go into an open space. So at this time, Don Miller is positioned in the right position, 2 feet away from the wall. Then lean the hip into the wall. As you can see, it's quite a stretch. It stretches the pelvic ligaments. This is held for 10 seconds, then push away for 5 seconds. And repeat the exercise 3 times. Now, this kind of exercise is very helpful for women to make certain that the outflow of blood from the pelvic organs is quite a good outflow. Congestion of the pelvis is an important cause of painful menstruation. Now, in the time that I have left, I'd like to discuss another problem that women have, and that is abortions. I feel that women often are not aware of the ill effects that abortions can have on the mind and on the body. Doing a therapeutic abortion or an abortion because a woman does not want a pregnancy is often the first thing that makes her have discomfort, either emotionally or physically, for many years to come. And I'd like to read so that I can emphasize the fact that that an abortion does represent a life that has not been completed. I'd like to refer you to Luke 1, the verses 34 and onward down to 44. You remember that Mary had just been visited by the angel, and the angel had told her that she would be the mother of the Lord. She went in haste to see Elizabeth, and when Mary greeted Elizabeth, the babe leaped in her womb. And then Elizabeth said, "How is it that the mother of my Lord has come to visit me?" Already she was the mother of the Lord. And so this is a living being inside the womb. My appeal is that this living being be protected. I hope this discussion will be of help to you.